So once again, welcome everyone, and today's topic is phlebitis. So today we are going to discuss about phlebitis, one of the very common word which we are hearing in our day-to-day medical life. So what is phlebitis is? So in this video we are going to discuss about phlebitis, the types of phlebitis, the scoring of phlebitis, how we are scoring the phlebitis, and how to manage phlebitis. So quickly we'll come to what is phlebitis means. So phlebitis is nothing but it is inflammation of veins. Inflammation of vein is known as phlebitis. The cause can be due to blood or without blood. If it is due to blood, this is termed as thrombophlebitis. So this is also one of the very common word which we are using and which we are listening in our day-to-day life. So this is thrombophlebitis. Now we'll quickly come to the causes of phlebitis. So we have numerous causes of phlebitis, but in today's session we'll discuss mainly about the three types of phlebitis or the three causes of phlebitis. One is known as mechanical phlebitis. The one cause is mechanical. Another one is chemical. And the third one is infective. So quickly we'll come to this. Mechanical phlebitis, as the name is telling, mechanical means whenever there is a wrong selection of. So if we talk about the mechanical phlebitis, mechanical is due to poor mechanics. So that means if the person who is putting the IV cannula is not competent, or if the person is untrained in putting the IV cannula, or the wrong selection of cannula or the vein, that leads to mechanical phlebitis. That means if the person is not competent enough in putting the IV cannula in a single attempt, he or she may have a chance to develop IV phlebitis. Next we have chemical phlebitis. There are certain drugs, specially concentrated electrolytes. For example, we have soda bicarb, we have magnesium sulfate, we have calcium gluconate, certain inotropes agents. These drugs have the tendency to get crystallized and they will damage the lining of your veins. So because of this, patient may develop chemical phlebitis. The third type of phlebitis is infective phlebitis. Infective phlebitis, as the name is telling, because of poor infection control practices. Suppose during the insertion of IV cannula, the site cleaning was not done, or the person who is giving any medication, he or she has not performed the hub cleaning measures, or the person while doing the IV cannulation has not done hand hygiene. So because of that, patient may lead into infective phlebitis, that is nothing but infection. So this is phlebitis and the different types of phlebitis. Now quickly we'll discuss about how to score phlebitis. So this is a scale which is given for scoring of phlebitis, commonly known as VIP. VIP stands for Visual Infusion Phlebitis Score. So here quickly we'll see the scoring. The scoring starts from 0, 1, 2, 3, 4, 5. If the patient is having a 0 score, that means IV site appears healthy and there are no signs of phlebitis. If the patient is having 1 score, so suppose patient may complain you of slight pain at the IV site or redness. If any one among both are present, you can give marks 1 and please observe for the possible sign of phlebitis. If the patient is having any two of the following evident, like pain, erythema or swelling, you just need to recite the cannula, and this is known as early stage of phlebitis. If the patient is having pain along with the path of cannula, erythema or induration. So erythema is nothing but this is a red discoloration of the site where the cannula has put on, and induration is that when the fluid or the medication which you are giving it is not going. But sometimes we are misinterpreting this condition with a positional, you can say sometimes we are thinking that because of the poor position or because of the faulty mechanics, the IV fluid is not going, but the reason behind that is induration. So if any sign in, like all the three signs are present in this, you can give 3 marks to this patient, and this is considered as medium stage of phlebitis. Here again I need to recite the cannula. Now comes the score 4. If the patient is having pain, erythema, induration or palpable venous cord. So again, this is a stage where this is known as advanced stage of phlebitis, and this is the start stage of thrombophlebitis. So again, you need to recite the cannula. And the fifth scoring, or the fifth, is the advanced grade, which is also known as advanced stage of thrombophlebitis. Here patient may complain of pain, erythema, induration, palpable venous cord along with pyrexia. So what you need to do is, so this is the 0 to 5 scoring of IV cannula, where 0 is considered as the healthy cannula, whereas 5 is considered as the advanced stage of thrombophlebitis. So now quickly we'll look into the note or the important points to be taken from this session. That is, number 1, the first question which student may have, that is like on what number, like from 0 to 5, like on which number I need to recite the cannula. So the most common number is 2. So if your patient is getting a score of 2, definitely you need to recite the cannula. But some patients are very sensitive. So if the patient is very sensitive, so on the score of 1 also. Sometimes if my patient is complaining of only pain and patient is very sensitive, so you need to change the cannula on 1 also. Another important thing is, if the patient is having a score of 3 to 5, like 3 to 5, you need to treat your patient for phlebitis. So treatment has to be given. So quickly we'll talk about the treatment. So treatment we can go for, one we know is sumac dressing. So sumac is what? Sumac is nothing but this is a medicine, or this is ointment. You can say this is ointment which is applied on the affected side. So this will help in reduction of the inflammation. Another thing we can use is thrombophob. Thrombophob is again a ointment which is used to reduce the inflammation, and patient can also advise for ice packs, because ice will also help in reduction of swelling or inflammation, we can say. One of the very most commonly asked question by the patients is like how much duration it will take to subside, and most of the time the healthcare workers are unknown about this fact, and they will tell like it will take 2 to 3 days and it will go on its own. But the answer is no, because if the VIP score is like 3 to 5, sometimes it will take like 7 to 10 days also to get subside, because the swelling is that much, because it will take like 7 to 10 days. And if the starting stage, if it is in the starting stage, like you can say 1 to 2, so it will take at least 4 to 5 days to go. So this is all about for this scale, that is VIP. So in this video we have discussed about the type of phlebitis, what is phlebitis, and the scoring of phlebitis. So if any one of you is having any doubt, you can just give me a message, or you can just direct DM me also. Thank you.